Tubal reconstructive surgery is actually a delicate, complex surgery that when a fallopian tube is blocked, it needs treatment whether or not you want to conceive naturally or not. So for our patient, in this case, she wanted a natural pregnancy, so the attempt was made to reconstruct the surgery. So I have it, imagine it as a pen, right? The inside of a pen, it has a barrel. So that is approximately the size of your tube. When it's blocked, we actually need to operate on this tube itself. So you need stable hands, steady hands, actually visualize optics, and a suturing technique where we actually need to put the tube together or remove part of it and suture it up. So there are multiple factors that can cause it to happen. In her case, it must have been her surgeries that she had prior. Diagnosis first was made from a HSG, which is called a hysterosalpingogram. That is a procedure done in an outpatient setting, in mostly radiology setting, where the patient, a dye is injected through the vagina to actually see the structure of the fallopian tube and the uterus. If there is any problem, it will be shown up. Like in her case, the fallopian tubes both were blocked. So there's different part of the fallopian tube, and it would actually show you which part is blocked. So that's how we could have identified both fallopian tubes were obstructed in her case. For the surgery, upon the routine entering of the abdomen, we located the tubes to notice where it was blocked. We started to dissect off any adhesions there were. That's cutting away all the tissues that were not good. And then we actually found the fallopian tube, which was, as I mentioned, the fallopian tube, and then another one within it. So we have to reach within that very small structure and clear away on any bad tissue or not viable, and we put it back together with very fine suture, maybe as fine as your hair, right? And suture technique very special, so it does not affect healing afterwards. So it was very technical, took a long time, so that was almost 3 hours. It was one of the first, actually it was the first reconstructive tuboplasty that was done in the public setting that actually led to a successful intrauterine pregnancy. So there's a couple that was trying to achieve pregnancy for 8 years and unsuccessful. And they came to Dr. Rozan, which are head of department. And as we know, it rolled forward to where we are today. Infertility is not rare. It's more common than we can actually predict. 1 in 7 couples actually are infertile. And the problem we have is that we do not actually come to seek help as soon as possible.